Be sure to turn off any radio, television, or other source of distraction when taking blood pressure so that you can hear very clearly the blood pressure reading. The patient should be warm and comfortably lying or seated in a chair. Refrain from taking a blood pressure for 30 minutes after the patient has had a cigarette or other tobacco product. If the individual is seated in the chair, their legs should be flat on the floor and not crossed. If they are in bed, their legs should be straight and not crossed. Never measure blood pressure on a person's arm that has a cast, fracture, burn, or any other kind of injury. Also, it's important never to measure blood pressure on an arm where there might be an intravenous needle in it. Never measure blood pressure on an arm that has had a recent blood test drawn. Also, if a person has had a breast removed, do not take the blood pressure on the side where that breast has been removed. And the last would be if a person has been paralyzed on one side due to a stroke or other neurological problem, do not take a blood pressure on that arm as well. The arm should be resting at heart level with the palm facing up. The arm should never be elevated above or below the heart level. The cuff needs to be applied directly to the skin. If possible, to roll the sleeve up, that's perfectly fine. But if it becomes too tight by having it moved up and is constricting the upper arm, or if you simply cannot have the cuff applied directly to the skin in that instance, then you would ask the individual or assist the individual to take that outer garment off. The cuff must be completely empty and flat before placing it on the arm. If you're unsure of your reading, you may wait 1 minute or longer and then retake the blood pressure on that same arm, or you could try taking the blood pressure on the opposite arm. If after 2 attempts you just are not certain about your blood pressure reading, then ask the nurse for assistance. Don't ever hesitate to ask the nurse to check your blood pressure reading. Checking and taking a blood pressure is a skill that takes time to perfect, and it's very difficult to become proficient after only learning the skill. Blood pressure measurements are recorded in even numbers. So, for example, if you felt like you got a blood pressure measurement that was a systolic pressure of 119, you would round that up to 120. Now I'd like you to watch a demonstration of taking a blood pressure. You will not be able to hear any of the sounds of the blood pressure, but I'd like you to focus instead on the blood pressure technique. Measuring blood pressure. Wash your hands. Gather needed equipment. Remove the sleeve if needed. Place the patient in a comfortable position with arms supported on the bed or table, palm up and at heart level. Clean the earpieces and the diaphragm of the stethoscope with an antiseptic swab. Point the earpieces forward prior to putting them in the ears. Test the diaphragm and bell to be certain that the tapping sound is heard. Check the gauge that it is at 0 before starting. Palpate the brachial artery. Center the bladder of the cuff over the brachial artery and 1 to 1.5 inches above the elbow. Estimate the systolic pressure by placing the bulb in the dominant hand for pumping it up, feeling the radial pulse with the other hand, inflating the cuff to 90 millimeters of mercury and increasing at 10 millimeter increments until the pulse is no longer felt. This is the estimated systolic pressure. Deflate the cuff rapidly and wait 30 seconds. Keep a mental note of the systolic pressure. Center the stethoscope over the brachial artery. Inflate the cuff quickly to the estimated systolic pressure that you obtained earlier. Release the valve and watch the needle or mercury descend at 2 to 4 millimeters per second. Listen for at least the first 2 consecutive beats. Note the number, but do not stop the descent. Continue deflating the cuff until the last sound is heard. Listen for another 20 millimeters, then release the remainder of the air in the cuff quickly. If you're uncertain of your reading, repeat the inflation of the cuff after 1 to 2 minutes. Record the reading on paper. Report the deviations to the nurse. Now that you've seen the demonstration of taking a blood pressure, this is going to be your chance to listen to some sounds on the following exercise, and I'd like you to write down in your student manual what you heard on each of these 6 examples of the systolic or the upper pressure number and the diastolic. And once you have listened to all of them, you can check your results with the answers that will be at the end of the tape. Remember that when you are listening for the systolic pressure followed by the diastolic, you want to be hearing at least 2 or more consecutive sounds before you determine that that in fact is the accurate reading. I'd like you then, if need be, if you get more than 4 millimeters of mercury difference from the answers at the end of this tape, I'd like you to replay those 6